empowering health systems to achieve top quality design by redefining synergies between international healthcare planners and local architects in Asian health construction context. Asia's healthcare systems are on the brink of necessary change, driven by digitalization, consumer expectations, and fragile existing infrastructures. A significantly large health construction activity is being seen in places such as India, Indonesia, Singapore, Hong Kong, and Macau. An increasing emphasis is being laid on involving healthcare planners from overseas, according to a 2016 policy address by the Hong Kong Hospital Authority. They foresee experienced overseas healthcare planners playing a significant role in their future projects. Key Asian markets are the epicenter of health infrastructure development, and they are importing crucial health planning expertise from developed markets. Large international firms such as HKS, AECOM, and HOK are participating in these projects. An added advantage of bringing in overseas firms is the research backing they have. They have dedicated research wings which add to their thought leadership. Examples of successful projects by HKS completed using this type of consortium includes the Gleneagles Hospital in Hong Kong, Parkway Shanghai Hospital, Macau Island District Hospital, and the Tata Memorial Centre in Mumbai, India. When starting to identify the synergies between local architects and overseas healthcare planners, it is important to look at the key project stages. These are concept, schematic, detailed design, construction documentation, and construction administration. A study took these stages from typical large public hospitals and examined items of responsibility for the local architect, the overseas healthcare planner, and others. It was found that while the local architect had more responsibilities in the early stages, they drop around SD and DD. Conversely, the medical planner's responsibilities start increasing in early SD and DD before tapering down towards the construction documentation. We mapped close coordination window as per current practice between the architect and the healthcare planner, starting at the end of concept to early construction documentation stage. And here are a list of key items of responsibilities these two share during this period. The next important item of synergy is the skills possessed by the architects and healthcare planners. On the architect side, it includes key skills such as building code, fire code, and MEP coordination. And on the healthcare planner side, it includes medical procedures knowledge, medical planning, and medical equipment knowledge. The skills then translate into activities specific to each party during the various project stages. This is an important step in mapping the synergies and is an opportunity for improvement. Now that we have established premise, identified the synergies, we start looking at how to improve them. A closer look at the timeline revealed that the period of close coordination needs to be widened. Responsibilities must be assigned earlier in the programming. For example, early review of codes with medical planners' involvement. Another key insight is assigning the interior design role to the overseas medical planner, since interior design and health planning go hand in hand. In terms of skills, we need to introduce cross-pollination of skills between the local architect and the medical planner. This would greatly strengthen the understanding of each other's diverse skill sets, foster stronger coordination, translate the user's comments into the construction stage, and ultimately result in improvement of the design quality. Skills such as medical planning, equipment knowledge must be made part of the architect's team. Skills such as building and fire code, knowledge of partition assemblies, acoustics, and so on be made part of the healthcare planner's team. Upon cross-pollination, a key improvement will be seen in sharing or partnering in terms of key project activities. For instance, blocking and stacking plans in concept, coordination of risers in SD, finalization of wall assemblies in DT, and review of shop drawings in construction documentation stage. An important element of the puzzle is the BIM workflow, which should be coordinated and sorted out in early project stages. In conclusion, regarding the timeline, redefine the responsibilities to increase the closer coordination window is important. And in terms of skill sets, the clients must write a cross-pollinated skill set as a requirement of tender. And after cross-pollination, project activities assigned to both start complementing each other. And in terms of BIM, the workflow should be driven by the architect while other consultants link the models to the architect's model.